Good morning and welcome to the second meeting of the COVID-19 Committee 2021. We've received apologies from Monica Lennon and Beatrice Wishart for this meeting, and we are joined by David Stewart, MSP, and Alex Cole-Hamilton, MSP, as their substitutes. And can I welcome both David and Alex to this meeting? This morning, the committee will be taking evidence from the Cabinet Secretary for the Constitution, Europe and External Affairs, Michael Russell, MSP, and Professor Jason Leach, who is the National Clinical Director for the Scottish Government. Whilst there was not a ministerial statement on the latest levels review scheduled for this week, this session gives members the opportunity to take evidence on this week's two ministerial statements on the COVID-19 vaccination plan and a COVID-19 education update, as well as a statement given yesterday by the First Minister at First Minister's Questions. We will also consider the following statutory instruments: Health Protection Coronavirus Protection from Eviction Scotland Regulations 2020 SSI 2020/425, the Health Protection Coronavirus Restrictions and Requirements Miscellaneous Amendment Scotland Regulations 2020 SSI 2020/439, the Social Care Staff Support Fund Coronavirus Scotland Amendment Regulations 2020 SSI 2020/469, the Health Protection Coronavirus Restrictions and Requirements Local Level Scotland Amendment No. 9 Regulations 2020 SSI 2020/471, the Health Protection Coronavirus Restrictions and Requirements Local Level Scotland Amendment No. 10 Regulations 2021 SSI 2021/1, and finally, the Health Protection Coronavirus Restrictions and Requirements Local Level Scotland Amendment No. 11 Regulations 2021 SSI 2021/3. Members may also wish to note that the committee took evidence on the draft version of SSI 2020/439 at its meeting on the 17th of December 2020, and the draft version of SSI 2021/1 and SSI 2021/3 at its last meeting on the 8th of January 2021. I would also note that a draft version of the Health Protection Coronavirus Restrictions and Requirements Local Level Scotland Amendment No. 12 Regulations 2021 were provided by the Scottish Government after the meeting papers were published. These regulations are therefore not formally on the agenda, but have been circulated to members as they relate to the First Minister's statement in Parliament yesterday, the 13th of January. Cabinet Secretary, can I welcome you to this meeting, and can I invite you to make a brief opening statement?
Thank you, Convener. Thank you for inviting me to give evidence on these regulations. Due to the time available today, I won't cover them all in detail in my remarks, but it's important to note that they all take important steps, not only to protect people from the new variant of coronavirus, but also to protect people from hardship, which may be seen as a result of the pandemic. Regulations before us today ensure people who are not at increased risk of homelessness over the festive period, a commitment which we are now extending to those in level 3 and 4, which cover the country. This is because it's become even more important now as a result of the new variant to ensure that people do not need to find a new home at this time, or are not forced to move from one place to another, or have nowhere to go. The Social Care Staff Support Fund Coronavirus Scotland Amendment Regulations is also being considered, and this provides financial support for social care workers who were shielding and were not placed on the UK Government Jobs Retention Scheme by their employer. I'm sure the committee will welcome these regulations and, of course, has discussed them previously with the Cabinet Secretary for Health. The other regulations before us make a number of changes to the local levels regulations. The most recent and significant changes include moving most of Scotland to level 4, with all other areas moving to level 3, and introducing a stay-at-home requirement for everyone living in level 4 areas. This new requirement is significant and was not introduced lightly. It was essential that we took action to ensure our NHS is able to cope alongside the usual increased demand over the winter period. As the First Minister set out yesterday, we have also made the decision to implement a further tightening of the lockdown restrictions to ensure they can be as effective as they must be in suppressing the virus. There are a number of changes we intend to make. The regulations that will give effect to these changes have been shared with the committee in draft form, and I apologise for that, but that is a result of the urgency of the situation. These changes include limiting the availability and operation of click and collect retail services to only essential retailers, all other click and collect services must stop from Saturday. We're also no longer permitting customers to go inside to collect takeaway food or coffee. Any food or drink outlet wishing to offer takeaway will have to do so from a serving hatch or doorway to avoid any indoor mingling. There are new rules being brought forward around consumption of alcohol in outdoor public places from Saturday. Again, it will be against the law in all the level 4 areas of Scotland to drink alcohol outdoors in public. Of course, that is the case in many Scottish areas anyway, with local regulations, but it will now be nationwide. It is, however, still possible for pubs and other venues to sell takeaway drinks, but they are for people to consume at home. The other changes announced this week include only permitting work within a private dwelling if it is essential for the upkeep, maintenance and functioning of the household, and an amendment to the stay-at-home requirement to ensure individuals are not remaining outside of their homes for non-essential purposes. Both of these changes reflect the spirit of existing guidance. They shouldn't require a change in behaviour for most members of the public. Whilst these additional restrictions are sadly necessary, it is, I have to say, not all bad news. We have now vaccinated more than 80% of care home residents in Scotland and more than half of frontline health and social care workers. Our aim is, as the First Minister and the Health Secretary said yesterday, to vaccinate all over 65s and those with extreme clinical vulnerability by the end of February. This means that by the start of March, 1.4 million people will have received at least the first dose of the vaccine. As the First Minister also said yesterday, vaccination offers us a route back to a more normal life and gives us real hope for the future. I hope that this does give the people of Scotland the motivation to continue to stick with what are difficult restrictions to our everyday lives, but they are necessary to keep ourselves and our loved ones safe. Convener, I hope that is useful to the committee, and of course Jason Leach and I stand ready to answer questions on it.
Thank you, Cabinet Secretary. That is very useful. I will now turn to questions, and can I remind members that we have approximately 8 to 10 minutes each for questions, so it would be helpful if we could keep our questions and answers concise, and if there is time for supplementaries, I'll indicate that once all members have had a chance to ask questions. And if I may begin by asking the first question, looking at the protection from eviction regulations, the policy note states that where possible, the Scottish Government has informally consulted with public bodies and other relevant stakeholders. Can the Cabinet Secretary elaborate on what informal consultation was undertaken in respect of the eviction regulations, and how is their use being kept under review?
Well, I think it would be important that I get Kevin Stewart, the Housing Minister, to give you details of that consultation because he is responsible for it. I can say, however, of course, that the regulations are not new. It is the extension of the regulations that we're talking about here. They were extended to the 22nd of January. They're now extended to the 31st of March. I think everybody would agree that that is essential. There was consultation, of course, on the regulations when they were first introduced in the coronavirus, I think the first coronavirus Scotland Act. That seems a long time ago now. And clearly that consultation was useful and did guide on what the actual regulations should be. There are, of course, exceptions to do with criminality and antisocial behaviour, and anybody who has dealt with these situations, as most MSPs will realise how necessary that is. But it is also essential that people are not put in a awkward and difficult position. But I will undertake to get the Housing Minister to write to you and to the committee to give you further details of that.
Thank you for that. Next question is probably directed to Jason Leach, but can I just ask, in terms of the data, are you seeing any sign of the situation stabilising in terms of infection or even improving? Are there any glimmers of light out there?
Hi, Convener, and thank you for having me back again today, and hello, everybody. I think glimmer would be as far as I would go. The last time we spoke, was that a week ago? We were talking of a doubling time of 2 weeks. So we had gone, the numbers are not accurate, but let's say we'd gone from about 750 to 1,500 in 2 weeks. And that would suggest within another 2 weeks, we would be at 3,000. And the doubling time is a very important indicator of the rate of acceleration of your pandemic, whether you're in anywhere in the world. That hasn't happened. So it would appear that in the main, the Boxing Day restrictions, which we're now seeing in the numbers, have stabilised at around 1,700 cases, give or take 200 in either direction. And that appears to not be falling, though. It appears to be stuck there a little, but it isn't accelerating. So glimmer is correct. I would just balance that with, remember, 1,700 positives has translated into 107 intensive care admissions in the last week. So the hospital admissions and the ICU admissions haven't yet slowed because we're hardwiring in prevalence and positive cases. But yes, I think there is some hope that the acceleration has slowed.
Thank you for that. My final question is, again, probably best directed to Jason Leach, and it's about the vaccine. There are figures in the vaccine plan announced yesterday for wastage of vaccine. And I just wondered if you could explain the circumstances of wastage and whether the estimates that are made in the vaccine plan are, in your view, acceptable, realistic, etc.
Yeah, so we have a kind of rounded figure of 5% for wastage of vaccines. That's what we use for the flu vaccine. It's what the WHO say is the rough global average. It's difficult to be sure, of course. I would absolutely hope that we would get it down below that. And in the flu vaccine rollout, we do get it significantly below that. But for planning purposes, it is traditional to talk about a 5% wastage. That happens for a number of reasons. It might happen because some of what you get, maybe the vial is bust or the seal is broken so you can't use it, or something happens with the syringe. I mean, it's human, so you have to take a syringe, put a needle on it, put it in the vat, so you can just make a mistake. So you could get the sterilisation wrong, or the needle could fall, or all kinds of just human error type things. Rare, but possible. And then at the end of your day, you may not use all the doses of your vaccine because it comes in vials of various sizes depending on Pfizer or AstraZeneca. We, of course, try and use them up. That's one of the reasons why I get asked, why did the 40-year-old so-and-so Clark S get it in the hospital? Well, that was probably to use up some of that wastage because somebody didn't turn up who was an ICU nurse because they were working or whatever. So there is some wastage in there. I would hope we'd keep that to an absolute minimum, and everybody in the vaccine clinics wants to use every precious dose of it. You can be absolutely assured of that.
Thank you very much. That's very helpful. Can I turn first to David Stewart for the next question? And David, before you ask your questions, if you have any relevant interest to declare, could you do so, please?
Thank you, Convener. I have no relevant interest to declare. My first question is to the Cabinet Secretary, and it's specifically around the protection from evictions. Can I thank the Cabinet Secretary for her statement, and I warmly welcome the protection, which I think he said is now to the end of March. My question is this: how many households are likely to be protected by this new legislation? And whilst I welcome the extension, is there, or extending it for the whole of this year, in light of the COVID crisis?
Thank you, and thank you, David Stewart, for those questions. In terms of the actual numbers, I think it's almost impossible to predict what those numbers would be because the nature of evictions, each eviction is of course unique, and there are different reasons for them. We will monitor this, and therefore we will be able, I hope, to be able to say how many we think have been avoided. But even that is difficult because I think the very fact that a piece of legislation is in place will mean that people will recognise that they should not proceed on that basis. So if David Stewart will permit me, I will also make sure that the Housing Minister is aware of that and is looking at those issues. In terms of extension, I think we should remember that we gave a very clear undertaking at the time when the emergency legislation went through Parliament on every aspect of the emergency legislation, that we would not use emergency legislation to substitute for the normal process of scrutiny of legislation. So what we're doing where we can do it is extending those things that require to be extended. And of course, the legislation itself will fall to be extended on the 31st of March. And the legislation has one further period of extension. That would be to the end of September this year. And I did make a commitment to the committee some time ago, and I think I made it in the chamber as well in the statement on the 2-monthly report, that we would bring forward proposals regarding the extension of this legislation, particularly as the due date for it expiring falls after the Parliament is no longer sitting. So I think it is fairly obvious from where we are now that we will have to bring those proposals forward. But I don't think it would be sensible then to take individual proposals and make piecemeal cases for them. However, I don't think anybody will want to see the evictions issue lapse whilst there is still need for it. So just as we have extended it from its original ending to the 22nd of January and now to the 31st of March, clearly we will keep that keenly under review. And if it is required within the circumstances of the pandemic, then I think you could expect it to be extended further.
Thank you, Cabinet Secretary. My final question, Convener, is to Jason Leach, and it's a wider question. The JCVI, the Joint Committee for Vaccination and Immunisation, said recently that current evidence remains that increasing age is the single greatest risk factor. But there has been some discussion from the Imperial College paper that younger people may be slightly more at risk for the UK variant. Could Jason Leach perhaps clarify these issues?
Thanks, Mr. Stewart. It's a very important point. One of the things about this new variant, and remember, variants will come, and this may change. So I've got used to saying the date when I give this kind of information, because it may vary over time. But today, this variant we're dealing with across Scotland and across the UK gives you the same disease, but is more transmissible, and therefore, if you are young, you are very, very likely to have a mild course of disease. So the difference in mortality between the over 80s and the under 19s is stark, very, very stark. And that's why the Joint Committee, with our support or our agreement, have decided to go through the vaccination in that very strict age grouping. There are three exceptions to that age grouping within the JCVI restrictions, and it's important for everybody to understand them. One is health and social care workers who are treating people with COVID, seeing the virus a lot, and they are going to be protected early, and those with pre-existing conditions in two groups, those who we call clinically extremely vulnerable or shielding, and those who are vulnerable in another way, so the flu vaccine group, for example. So they will all come earlier, but in the main, this disease is still very mild in the young and still quite hard to transmit in very small children, so primary school kids, nursery kids. We're not seeing any increased numbers in that group beyond what we would expect because of the prevalence we're seeing in the country.
Thank you. Our next question comes from John Mason.
Thanks very much, Convener. Firstly, the question of long COVID has been raised with me a few times, and I'm just wondering where we are with that. I mean, there's been various figures in the past. I think that, for example, 10% of people still had symptoms after 3 months, but then I think it was suggested in Italy it's 40%. And do we have any idea at the moment if the vaccines are having an impact on long COVID?
I think that's obviously a question for Jason.
Yeah, sorry, Mr. Russell. I should have let you give it away. The post-COVID syndrome, which is what we're now trying to call it, long COVID for short, we don't understand it fully. It's fair to say nobody does. We have now published, for the first time actually across the UK, a joint statement and guideline from NICE, which is our version of much of NICE, and the Royal College for GPs have published a joint guideline for, particularly for primary care, for GPs and community nurses to understand it a little bit more. That contains the most up-to-date information we have about what it is, what kind of symptoms people present with, but it is poorly understood as yet, just because of the time we've had it. The numbers are also poorly understood. We think it is, we're defining it at around 3 months, as you say, Mr. Mason, and it seems to be more prominent as you age. So just as the acute disease affects older people more, so does the chronic disease affect older people more, it would appear so far. So we're not seeing it in children, for instance, we're seeing it in older age groups. It's a mixture of inflammatory disease, some cardiac disease, some tiredness and post-viral disease, all these things together. So that's why we think the best place for it initially is in primary care, in GP practices, and then moving through the specialties as that becomes required. So perhaps a cardiology appointment, perhaps a rheumatology appointment as that's needed, and we'll keep that under constant review. No indication yet that the vaccine will help or not help. Your basic instinct would be that if the vaccine stops you getting disease, particularly severe disease, it would reduce post-COVID syndrome, and that's what we would expect to see over time.
Okay, thanks very much. That's helpful. Secondly, I think there's been an issue raised by some of the deep end practices, which are the GP practices serving the 100 in the 100 poorest areas, and that certainly includes parts of my constituency. The point being that life expectancy in the poorer areas is lower. So if we're starting with the 8 oldest people, that means that we're going to do more vaccinating in the better off areas to start with. And that does seem a little bit strange to me because, you know, if somebody in my constituency is dying at 65, but in Bearsden they live till 85, that person at 65 who's in very poor health is going to have to still wait quite a long time for the vaccine. Can you give any response to that question?
Again, it's very difficult. You're right, because an 85-year-old in one part of our community can look much like a 70-year-old in another part of our community. And like most infectious disease, there is a gradient of equality here. And we've discussed that at this committee before, that COVID, like most infectious diseases, exposes inequality in society. Very, very hard to think of a way of accurately measuring that risk and applying it to the vaccination programme. So the Joint Committee do have ethicists and virologists and others on their group to make those kind of really, really difficult choices. And when you remove everything else, the thing you're left with is age. And age is really the biggest risk. So inequality is in there, so is ethnicity, so is obesity, but all of those are shrouded by age. So that's why they went for it. Now, we're going to get to the 75-year-olds, the 70-year-olds pretty quickly for a vaccination programme. So I think you can reassure your constituents and those deep end practices that we'll get to them just as quickly as we possibly can.
Okay, that's great. We'll maybe come back to that another time, but thanks very much. And my third and final issue I wanted to touch on, as I understand it, we're going to require international arrivals to have been pre-tested before they come. And I think I saw that there was only going to be spot checks done at the point of entry. And I just wonder why only spot checks? I mean, there's few enough people travelling. Could we not be checking 100% of people?
I think, if I might just take that on board, the final arrangements for the new dispensation are now being put in place. And at the present moment, as I understand it, then there will be fairly rigorous checking for those involved. But I would want Mr. Mason to find out precisely what the thinking is on this at the implementation, which will be, I think, tomorrow, and to come back to you on it, because I think many people agree that the firmer and clearer we are about A, there should not be international travel except in the most exceptional of circumstances, and B, if that travel is undertaken, then those involved have to put themselves through a very rigorous process in order to ensure that they are not bringing disease in or taking disease out. So if I can make sure you get a fuller briefing on that and how it operates, then I think that would be useful.
Thanks very much, Convener.
Thank you, John. Our next set of questions come from...
I think Jason has something he wants to add to that.
Only very briefly, sorry, Mr. Mason. 100% will be checked before boarding. Spot checks will be post-arrival. So you won't get on the plane without the test. 100% checked. The border force, the present plan is border force will then spot check a number of arrivals, just as a double check to make sure the departure check was intact.
And I should point out that there is a penalty for the carrier as well as for the individual. And that has tended to be quite an effective way of ensuring compliance, because carriers, particularly at this stage, do not wish to be fined and fined heavily for breaching the regulations and allowing them to be breached.
John, do you want to add anything to that?
Sorry, I was just trying to ask, would it be the carrier will do the checking at the departure airport, just as they check a passport?
So I'm not sure we know the exact logistics of that yet, where it will be if you're in Antigua or Mexico City or Paris. So at some point in the series of checks from passport control through customs through each of those points, they will have to have a check, and the final responsibility will be at the gate for the airline. So the airline will have to be sure. Now, where they do that in the processing, I think will be a logistical challenge for them, just like they have to check passports at some point in the process of boarding the plane.
But there will be a responsibility on the there will be a responsibility on the carrier, and therefore they will check that.
Thank you for that. Our next set of questions come from Mark Ruskell.
Thanks, convener, and morning to you both. Absolutely welcome the extension of the evictions ban to the end of March, but I'm also aware that in a number of European countries, they have a wider winter evictions ban. And I'd be interested, Cabinet Secretary and Kevin Stewart's views on that. Obviously, we have an emergency evictions ban in relation to the COVID crisis right now, but I'm interested to know if that would feed into wider housing policy and consideration of that.
Well, I can't speak for Kevin Stewart on that matter. I think that is a matter that needs to be taken up directly with him. It's not related specifically to the COVID issue. The COVID issue is clear that there should not be evictions in almost all circumstances, given we are living through a pandemic. I say almost all, because you will know, Mr. Ruskell, as I know, that there are circumstances in which it is intolerable to live next to people who are behaving in a way that is utterly selfish and destructive. And sometimes there has to be eviction in order to cope with that. But the presumption here is very much that people should be able to continue in their houses and not to have to seek somewhere else during this very difficult period. But the wider policy will be for Mr. Stewart and obviously a matter that is worthy of discussion.
Okay. Can I turn into the vaccine strategy? I think it was quite clear yesterday when Jean Freeman gave her statement in the chamber that government is following JCVI advice. The priority right now is absolutely on those who are clinically vulnerable. My question here is really about the next stage, looking ahead to the months to come, and in particular the 18 to 50-year-olds who are not clinically vulnerable, and when government will be able to, and how government will be able to consider any kind of prioritization of particular professions. We've had discussions previously in this committee about teachers or shop workers or other essential workers in that category. Is that something that you're looking at, or is it about going back to JCVI and saying, well, you tell us what to do? Or is government looking at political priorities, looking at the harms, the wider harms that COVID delivers to the economy and society, in how you then prioritize that 18 to 50-year-old group? I'm not sure who wants to ask that.
Just make one. I think Jason needs to answer that, but let me make one point. We are very keen to ensure that we follow the JCVI advice. That is what we are doing. So that is our priority at the present moment in time, and to make sure that we get this done as quickly as possible and with public buy-in and public understanding. The wider policy and the continuing policy is a separate issue, but Jason might want to address that. He has much more experience of it than I have.
It's the second of those, Mr. Ruskell. We will seek and take advice from the JCVI. The JCVI is an ongoing active thing. It meets all the time. It's already changed its advice around vaccination for this disease a couple of times, around pregnancy and breastfeeding, around the gap between first and second doses. it is a very active set of intellectual academics and operational delivery people who make those choices. They already know that phase 2 prioritisation is a question they're going to have to answer. They can't answer it today, partly because we don't know which vaccines we will have by the time we get to there. We may well have a different batch of vaccines, including the ones we've already got, but we're hoping to have Moderna by then, for instance. So we need to see the research on Moderna, just exactly how it's going to be given, how it arrives, all of those things. So I imagine there will be some form of prioritisation of that 18 to 50-year-old group, and JCVI will help us do exactly that. And your questions are completely legitimate. Should that be key workers? Should it be kids first before adults? Should it be adults first before kids? Whatever that works out to be.
Right. So what you're saying is that you would expect some flexibility in the way that government can interpret that JCVI advice. I'm just thinking about, if I was offered a vaccine in that second phase, I'd be prepared to wait a few weeks if it meant that a shop worker or a teacher could get that ahead of me. And I'm sure everybody's thinking about that. Where do they sit within the priority if you don't have an underlying health condition, that is, when you should get the vaccine? So I'm not sure how government will make sense of that, or is it just clearly a clinical decision?
It will, in the main, be a clinical decision, but you've seen some slight variation across the countries, even within the JCVI advice. So we followed the JCVI advice, but because of our geography and the nature of our country, we decided to do care homes as quickly and as fast as we could. England decided, partly because of their scale, to get into the over 80s at home slightly before us. And both will catch up. We'll end up in the same place within weeks. So I think there will be some flexibility, but I would expect the JCVI to be pretty strong. They won't say that Mark Ruskell should get it on the first week in June, but they might say that those in your age band, and I would never suggest which age band that was, Mr. Ruskell, should get it at this point in the process, as opposed to this point in the process, based on risk.
Okay.
And I think
if I could move
just to stress can I stress a key point, just in case we divert into the minutiae of this, and I do understand the desire for a debate about it, but there is an overriding priority, which is to get the job done, and to get the job done as quickly and efficiently and effectively as we possibly can. In this analogy that the First Minister uses in the race that we are in, the race between the virus and the vaccination, we want to win that race, and therefore, it is important that we are all working towards that end.
Okay. Thanks for that. Can I move on to the UCL study, which came out yesterday? There's some positivity, obviously, in there, but there were two worrying aspects that jumped out at me. One was the fact that less than half of people who develop symptoms are then going on to request test. You have to wonder why. Is it fear of loss of income or some other factor? And then another result that came out of the study was that over a third of people are not self-isolating for the recommended period. What are your thoughts on that? How do we support self-isolation? How do we ensure that people who should get a test go on to get a test, whether that's PCR or anything else?
Well, I'll let Jason deal with the majority of that, but just to repeat an answer that the First Minister, I think, gave to Patrick Harvey yesterday, we continue to work as hard as we can to make sure that the message gets across that those people who have symptoms should have a test, and there is support for isolation. Those are important messages, and we need to make sure those messages get across. I've said to this committee before, there's a role for all of us. Whatever party we're in, whatever role we have, whatever job we have, there's a role for all of us in sending those messages out. If you have symptoms, get a test. I think the First Minister says that every single time she does an event. And there is support available for isolation, and that support we want people to draw down and use. But Jason might want to say a word or two about the study.
It's an excellent point, and I think we sometimes think this disease is slightly more linear than it actually is, and our response is therefore linear. Now you have to have a testing program and a contact tracing program and a self-isolation program. Of course you do. But actually, when you get these symptoms, they don't suddenly, oh, I've got COVID symptoms. You actually gradually develop these symptoms a bit like the cold or the flu, and people hesitate sometimes about troubling us or bothering us, or they don't quite understand, is this the cold or is this COVID? And then you get quite quickly into inequalities. So I am able to self-isolate. I have a salary. I have a job that will support me in my self-isolation. I have a house that allows self-isolation to be relatively straightforward. I can get groceries delivered. The world doesn't look like that in the main. It is much more difficult. People have childcare challenge. People have caring responsibilities. If you ask somebody to self-isolate who doesn't have the support of their employer, so there are multiple layers here, which I think is exactly what you're getting to, Mr. Ruskell, that I think need dealt with in sequence. And we've tried as much as we can with the public health advice to employers, to individuals, with the communication, to try and tell people this is the most important thing they can do. But if you're getting asked to self-isolate for the second, for the third time, and you're an Uber driver, or you're in the gig economy somewhere, or you're a student, that's not as straightforward as it is for you or I to be asked to self-isolate. And I think we have to be conscious of that in the support we give, in the advice we give, in the language we translate our resources into, all of those elements to make that as straightforward as we possibly can for people.
I mean, you're showing a lot of consciousness of that problem, but I'm still not seeing the self-isolation support grant being available to anybody apart from those who would qualify for universal credit. So that probably doesn't include your Uber drivers. So are we there yet with the self-isolation support grant being as available as it could be?
Well, I think the First Minister was clear yesterday that we continue to look at it, we continue to try and find ways to assist with it, and we want to do so. So there's no unwillingness to do so. And I think she also indicated, if I remember correctly from the answer yesterday, that if people are turned down, then the local authority is trying to be as helpful as possible as signposting alternatives. And she made it clear that she wants to go on doing that. So we are very keen that it takes place. We're very keen that people get support who need support.
Okay, I'm going to move on now, please, to Alec Cole-Hamilton. And Alex, if you have any interest to declare, can you do so before you ask your question?
Thank you very much, convener, and it's great to be here. No, I don't have any relevant interest to declare. I've got quite a few questions to get through, so I will do them in a kind of quick-fire basis. I appreciate there's a lot of ground to cover. The first is directly for the Cabinet Secretary, and this is something we cover quite a lot. Then I've got some questions about the restrictions, and finally on the vaccine. Cabinet Secretary, we now know we're not yet at the peak of this second wave, but it's clear that there are significant aspects of our health service which are not overwhelmed in the way that we expected them to be when we were preparing the original coronavirus legislation. So I'd like to ask why we continue to have the temporary changes to the Mental Health Act, which double the amount of time that people can be held under section order, and also removing the need for 2 doctors to sign off on that. I know you'll come back at me and say that the Society of Psychiatrists say that that's the right thing to do, but I look at this from a human rights-based perspective, which would say that we really need to repeal this as soon as possible.
I've answered that question from you, I think, on each occasion we've had a report, and I will answer it in the same way. The situation's not changed. The professionals involved here strongly believe that this should be in place because they believe it could be needed. It is not being used, and we hope it won't be used, but it is still needed. Now, that is a debate we can have each time there is a report, and as the legislation comes up for renewal, no doubt you will make the point again. We do review and internally review every provision in the 2-monthly cycle, and if we came to the conclusion that the balance of this issue had changed, then we would recommend removing it. We have not done so as yet.
Okay, thank you very much.
It is, in a sense, irresistible force and immovable object on this one between you and I. I don't want it in the legislation. I'm not a fan of it. But if the people who believe it is necessary are qualified as they are, I tend to listen to them.
We also need to listen to human rights professionals as well. I'll move on quickly to Yes, indeed. I'll move on to a couple of very specific points on the restrictions announced yesterday, and this has really come from quite a few emails from constituents just looking for clarity, which I was unable to give them. Firstly, as I'll direct this to Jason Leach, on private construction, as in workers in homes, it was quite clear that that's on a maintenance and upkeep basis only. I've had people who are in the midst of knock-throughs and extensions. Are they allowed to continue? And if they're not, are the workmen allowed at least to make their properties weathertight and safe and secure?
Well, I mean, Jason doesn't need to answer that because it's quite clear. Okay. You would not leave a property that was not weathertight and unsafe. You know, that would be a criminal offence. So quite clearly you should finish that, but no, you shouldn't. I don't think you should continue with non-essential activity. Can I just stress something I've stressed at the committee often before, Mr. Cole-Hamilton? I just want to do it again. It is the purpose of the regulations that is vitally important, as much or more than the detail of the regulations. And the purpose of the regulations is to stop people mixing, in this case, stop people mixing indoor. So where it is not essential for people to mix indoors, I think it is absolutely clear that should not happen. It is therefore not essential for something to be finished, but equally it cannot be left unsafe. So I think applying a very clear, logical approach to this is necessary. I know it is difficult as MSPs. You get it, I get it. People are looking for definitive views, but you know, it is. If you go back essentially to the purpose of this, it does lead you to the correct conclusion.
Thank you. Now moving on to the prohibition on drinking in public. I understand absolutely the reasoning behind that, but I've had questions as to what that means. Is that a prohibition on all drinking outdoors? So, for example, if, as we were allowed to do, meet one other person in the garden, you couldn't have a glass of wine with that person in the garden. How far does that prohibition on drinking outdoors go?
Well, I don't think socialization is to be encouraged. So if you were planning to have even a one-to-one party in your garden, I would strongly counsel you against it. But equally, a restriction upon alcohol in public places already exists. I mean, I'm speaking from my own constituency. That restriction exists in my constituency as a local government bylaw, right? So it is to prevent the consumption of alcohol in public places, and it is specifically to prevent circumstances which I know have been seen, you know, in parts of Edinburgh and elsewhere, as you will know, where a pub selling alcohol at the door, so to speak, people are gathering at the door to drink it as if they were in a pub. You know, and that is what it is, again, the purpose of it that is really important, to stop people gathering together. So, you know, if you wish to have shall we say, a glass of Prosecco in your garden, you know, nobody is going to come around and stop you and seize the glass from your hand and dash it to the ground. But equally, gathering together is not what we want people to do. That is where the risk is. Jason might want to say something about that gathering, because that's the vector that is the issue.
It's pretty straightforward. It is illegal to leave your home except for essential reasons. Socialising in somebody else's garden is not an essential reason. You and your household can drink in your garden if you wish, Prosecco or otherwise, but you should not be leaving your house to socialise with other people in their garden. You can leave your home to exercise with a single other person from another household. That could be a walk, that could be a run or a cycle, but you are not permitted to leave your house for socialising.
Great, that's very helpful. Thank you very much, both of you. I'd like to move on to the vaccine now. I'm sure lots of other MSPs have had this as well, and it's actually very overwhelming and quite inspiring to see the number of retired clinicians or trained clinicians who have left the profession and gone on to do other things get in touch to say that they want to volunteer to help with the vaccine effort. If you Google volunteer to help with the COVID vaccine, you're taken to a very shiny NHS England portal where you can do exactly that for the vaccine effort in England, but there is no such, well, apparently no such one in Scotland. Why is that?
I think Jason would have to answer that. I'm unaware of that.
So in the vaccine deployment plan yesterday, we have a couple of ways of people offering both their premises and their individual help. We don't need any more volunteers just now. We have 4,000 people who have done the vaccine training, dentists, optometrists, those who conventionally vaccinate for us as well. So we have enough people. It equates to I can't remember the exact numbers, but we've got a set of people who do the vaccine, and then we've got a set of support staff who will help with that, some military personnel, some others who will help with traffic in the mass vaccination centres, all of that. So we are absolutely on track to get the workforce we need. If we need more, then we will put out a call for that, and the health boards will do some of that for us. So we do not need mass volunteering at this stage of the vaccination programme.
Thank you. I've got two final questions, Convener. The first one is if we had a sufficiency of both vaccine and vaccinators, as it seems that we're starting to do, is there anything to stop us moving to a 24/7 operation in terms of offering people appointments?
Nothing. But except you want to go for your vaccine at 4 a.m. when I can give you at 8 p.m. So I think it's taken on a bit of an iconic status that I think it's not worthy. It makes for good headlines. So the fundamental answer to your question is, you want 24/7, you can have it. But we've got vaccinators working 8 till 8, working their socks off, round the clock, in and out of care homes. I don't think care homes want vaccines at 3 in the morning. If people want vaccine at 3 in the morning because they're on night shift, because they're a midwife, or that is already available inside the National Health Service. I think it's a little bit of a red herring, the 24/7 thing that's in, it makes for a nice front page. So if they want the front page, yes, 24/7 is available.
Okay. Final question. We heard yesterday in the Cabinet Secretary's statement about the involvement of the UK Armed Forces in the deployment, but she quantified that and said that actually there were only something like 33 Army personnel helping with the vaccine rollout in Scotland. That seems a very small number. Why is that, and why couldn't there be more helping?
I can do that
because that is. Well, before you do, Jason, just say I presume that's because they're needed, but it's not a new thing. I mean, we're grateful to the armed forces and have been from the very beginning. I remember at a very early stage of the pandemic, just when we were doing the first emergency legislation, going into St Andrew's House and finding one of the conference rooms full of military personnel. Military personnel have been involved in assisting from the very beginning, and that has been very helpful. But Jason can give you, I hope, a specific answer to the numbers.
There's a little bit of a misunderstanding about military personnel, I think. Almost all the clinical personnel who are armed forces work for us already. The armed forces doesn't have many dedicated now clinical personnel. They all work for the National Health Service and then are deployed to Cyprus or Afghanistan or wherever when they are required. So we already have them. Vaccinators, ICU doctors, oral surgeons like my specialty. And what we do use them for, in addition, is the logistics, that bit of the puzzle. And that's where that number of about 30 comes from. If we need more to staff vaccination centres like we've used them in the past to staff testing centres, we will do that. What we did with testing was we transitioned to the ambulance service running a lot of our testing centres. And that seemed an appropriate thing to do. The armed forces don't want to be in there forever. And that's what we've done with testing. That's what we'll do with vaccination. They are absolutely available. They've been hugely helpful, and they've made themselves available for this point of the pandemic too, and we'll use them as we need them.
Thank you, Convener. Thank you to the panel.
Thank you for that. We will go now to Maurice Corrie and then Stuart McMillan. Maurice Corrie.
Thank you, Convener. Yes, on that very point, on the military staff, from my own experience, absolutely yes. The way that the military works, for those who don't know, is that the majority, as Jason says, of our reservists and regulars work within, particularly reservists, which make a main core of the medical corps, actually serve within the NHS. And by that, why that is done is because it hones their experience really up to date with the modern teaching and methods, so that we have on call under the military assistance of the civilian authority legislation, that they can be called up any time. So that just clarifies that point. Can I just move on to my couple of questions? Yes, I'm getting a lot of questions about teachers and the classroom support staff vaccination program, and there's concerns about them not being seen as a priority or any priority. Now, I know it's been addressed already by my colleagues just now, and yourselves, Cabinet Secretary, and also Jason Leach. Is there any further we can do to give them confidence? Because it's a question I'm being raised with day in, day out on that one.
Well, I'll let Jason address the medical and clinical aspects of this, but simply to say, to confirm what John Swinney said again yesterday, and the First Minister has indicated too, as has Jean Freeman, we keep this under review. we understand the concerns that come. I'm a former education secretary. I fully understand the concerns that come from teachers in the classroom and from others within schools, and we do keep this firmly under review, but it will be driven by the clinical needs and what we believe is the effective way to operate, and that's how it should be. But Jason might want to say a word or two about that.
Yeah, so the basics we've done. I think the other element you raised, Mr. Corey, is the communication with school professionals, classroom assistants and teachers and everybody else, and we should get that as good as we can. I live with a teacher, and she and her pals ask that question, and it's a legitimate question to ask. When it is answered, I think most of them, the vast majority of them, take that and think, well, let's make schools as safe as we can using everything else, and then we will catch the clinically vulnerable teachers and staff. We will catch those who get the flu vaccine and all of the teachers and support staff who are over 50 in that first set of priorities, and then we'll get to those who are at much lower risk. It's about explaining the risk to them of being in the schools, and I understand why that feels riskier than it actually is in reality. So it's about trying to explain that, and I've tried to do that. I've done some video clips for teachers. I've spoken to the unions. I've spoken to many schools, in fact, to try and get that message across. But there's always more we could do, of course.
No, that would be great. Can I just move on? It's really based around communications, because marketing communications is my area. The question I'm also being asked by community councils is sort of some form of publication of headline facts and maybe 5 key points as we progress each day through this process. And I'm just wondering if that could be done on your communication package, Professor Leach.
Yeah, it's not a bad idea. The communication, the marketing department in the Scottish Government, it gives me the opportunity to say they've played an absolute blinder. I mean, the work they've done pretty much 7 days a week is amazing to get the level of communication and marketing out there. I don't think that's a bad idea to get to that community. My question maybe for offline is, how do you access that community? Is there a way of getting to all of them, all the community councils? Is it via the local authorities? Is it so? I don't think it's a bad idea. It might not be daily, but it might be in sequence. You could give them information to share, because we need MSPs, MPs, and other elected officials and everybody else locally to get those messages across. I think it's a good idea.
I think what it is, it gives positive reinforcement. And I know that the way to do it is actually with the local authorities who then manage the community councils. And I'm attending one tonight, in fact, over in Ralston, near Paisley. And that's the question I'm going to be asked, is what are the 5 key points? So I would appreciate that could be considered. And finally, if I may just say, the question about winning the race, which the First Minister puts across, and you again, both of you re-emphasise this is a point for both of you. Can I make a suggestion too, that we have the appearance of all the party leaders in the Scottish Parliament coming together, holding placard with facts, one has an F, one has an A, etc., and therefore showing them winning the race together, because you know there's nothing more powerful than a statement cross-party wise.
I entirely agree. I think that there should be a unanimity of view, that you can differ on some of the detail of the programme and of course scrutinise the programme, but there should be a unity in trying to achieve the outcome. It is not in my gift to ask or to ensure that party leaders, yours or anybody else, do things, but I'd be very keen to see people coming together and being positive. And I think both your suggestions are good ones, and they're taken on board. Maybe you should go and speak to your party leader and get her to suggest it to my party leader, and maybe above our pay grade it could be done.
I shall do that, Cabinet Secretary, Ms. Sightley. Any comment on that, Jason Leach, in relation to delivering the message?
No, I think it's an excellent idea. I think political leadership in this pandemic across the world has proved to be crucial. I would, of course, say we need to do that in combination with clinical leadership, and the places that have done that communication well, I think, have done both. Have done the political leadership and the clinical leadership, often together, in fact. But yes, the more consensus across the parties, at least in the focus on what the prize is, I think is important.
Because quite rightly, as you said before, and as we said in many occasions, is the positive reinforcement is the one that makes people actually make their mind up positively and not negatively, and actually go and get that vaccination and stop being an anti-vaxxer or whatever the case may be. So that's important.
Irrespective of their political allegiance, perhaps.
Thank you for that. Could I turn next to Stuart McMillan, please?
Thank you, Convener. First question just regarding the Social Care Staff Support Fund. Can the Cabinet Secretary tell me how many staff will this actually affect, but also can he ensure that this will guard against the hardship of social care staff?
Well, on the second point, yes, that's what it's intended to do. On the first point, I don't think anybody knows precisely how many there are. Quite clearly, they are self-identifying, but it is regarded as a small number that are involved, but nonetheless, it needs to be taken care of. And that's why this regulation is in place, to ensure that nobody suffers hardship as a result of the circumstances that they have found themselves in. From now on, indeed, I understand from last year, then these individuals will be furloughed or paid in the normal way. But there was an anomaly at the start of the process, and this is trying to deal with it.
Well, thank you for that. The second point is regarding the pre-departure testing that John Mason touched upon earlier. And can I clarify, is this a Four Nations approach? And also, is this something that could have happened sooner? And if it didn't happen, obviously clearly didn't happen sooner, were there any particular reasons why it didn't happen sooner?
Yes, it is a Four Nations approach. I think, in the fullness of time, we will discover why certain things didn't happen at certain stages. There is a question of making sure that borders are not porous, that people do not travel. That has been a key issue, and there are certain powers that exist in Scotland and certain powers that don't exist in Scotland. And you, Mr. McMillan, and I are very aware of that, and I'm sure others are as well. But I think the important thing is to get as effective a process as we possibly can to make sure that the virus is not carried into or taken out of the country. And the simplest solution to that, and I just want to stress this so that we don't get completely distracted by the view that having a test is going to be all and end all, the simplest answer to this is not to travel. And in actual fact, that is the law at the present moment. People are not to travel except in very exceptional circumstances. And that's the message I would want to get across.
Well, thank you. And so my next question actually kind of touches upon that, but it's not so much about now, it's about the future. I know there's been some dialogue about kind of around this type of area in the past also. Also, are you aware of any research or planning being undertaken about the effects of reopening global travel, bearing in mind that there are various vaccines that have been utilised across the world, and also various strategies are actually being utilised to deliver those vaccines in different countries?
Well, I'm not aware of any such research, but Jason will know much more than I do about the issue of vaccination across the globe, because there are different approaches. I had a conversation with somebody in Canada yesterday about their program, and they were expressing some reservations about some of the issues there. There are obviously problems and possibilities in every country, but I'm not aware of global travel issues. But Jason might want to talk about global approaches to vaccination.
Yeah, so this is a really important thing for the medium term. Let's be clear just now, Scotland and the UK is an exporter of virus. Our numbers are high, and we are exporting virus to other places. But I really hope there will come a time when our numbers are low enough again to be talking about importation of virus and making that very, very clear that we have to do something about it. The WHO have said for a year that one of the key elements of control is importation. Now that could be as I've said many times, that's not anything to do with country borders necessarily. That might be importing it into Elgin, or it might be importing it into Scotland, or it might be importing it into the whole of the UK. So you have to have a policy position, which is partly above my pay grade, about what you're going to do about importation. And that is partly a Scottish problem and partly a UK problem, and it's a global problem. And the WHO will take a view as we move through this pandemic, as they have done at every stage, about what vaccination means for that. We don't know yet, and we probably won't know for another 6 weeks or so, whether the vaccine helps with transmission. The vaccine helps individual protection. We don't yet know. We expect it will. Most vaccines do, but we cannot be assured of it until we have enough vaccine in people and we can monitor it. over time about whether it stops transmission. Then you'll have to do work on, does this vaccine do the same as this vaccine? We expect them all to be roughly the same, but again, that just needs time. And the WHO and international researchers, led often by UK researchers, will do some of that work for us. But to go back to travel, travel is one of our Achilles heels here. There are still tens of thousands of people arriving in the UK every day from international destinations. So we now have quarantine for some travel corridors. We have pre-departure testing starting in the next few days, but none of that is foolproof. None of that can stop the virus completely. So we need the government, with public health advice, to take a view as we get these numbers down, which we did in June, to take a view on what we are going to do about importation of virus. And that won't be forever. That's not banning global travel for a decade. It's about not having a third wave.
Certainly, thank you for that. I mean, my thinking on it is probably kind of more towards the second half of this year, but particularly probably the final quarter. Obviously, when the vaccines have been rolled out, the various strategies, such as obviously in Scotland and in Europe, it's about the older population going down. In other countries, it's about working age population going up, and also the various vaccines, what's been reported as the different efficacy of the different vaccines. When at some point global travel will reopen, and my concern is about the vaccines that have been undertaken, the strategies that have been undertaken, will they actually be enough to ensure that global travel can once again be safe, and that the importation can be reduced to a minimum, so that we can start to reopen economies, get our tourism sector working the way it has done in the past, and to actually have a better quality of life as compared to what we currently have.
I think we should.
Sorry, Mr. Russell.
But I think we should call canny on such speculation at this stage. We are, as the First Minister has indicated, at a very, very perilous moment of this particular pandemic. We need to focus on what we need to do to ensure that we move through that and move through it as safely as we possibly can. Undoubtedly, the issues of what then happens thereafter in terms of travel are of importance, but I wouldn't start speculating about when that will be or how that will be. Let us get this job done. And I really do think that is important. Let us get this job done.
Okay. No, thank you very much. Thank you, Convener.
Thank you, Stuart. Our next questions come from Willie Coffey.
Thanks very much, Convener, and good morning to everyone. A couple of questions from me. Firstly, to yourself, Mike. The most common issue that's raised with me by constituents here in Kilmarnock River Valley is the numbers of people still gathering, of course, at the supermarkets and the retail parks. In relation to non-essential retail, my understanding is that if they sell items, goods or otherwise, that are deemed to be essential, like food, tins of food, cat food, dog food, then they remain open, but people can still buy other products and so on when they go there. A lot of my constituents feel that we need to address that to give us a chance to reduce the numbers of people that are going to these places. They seem to be the last places out in society where we have multiple gatherings of people still taking place. I think that's quite obvious. Is there anything we can do to assist this, perhaps to reduce and restrict the products that some of these non-essential retail outlets can actually sell?
I think we gave an indication yesterday of our desire to further restrict this, regrettably, but we gave an indication of it. That is, first of all, by restricting the click and collect process even further and defining what is acceptable and what isn't acceptable. I think the second indication we gave of this, of indicating that we were stressing that you should not leave the house, unless you were for an exempt purpose. So you can't leave in order to mill around the shop, in the off chance that you can buy something other than cat food. I think that is really important, and that is a message we need to get across to people. There is no normal shopping being undertaken, and the third thing is to make sure that local authorities, who are empowered to do so, are advising retail premises whether or not they can stay open, and also on how, if they can stay open, they can operate as a business. And we are encouraging local authorities so to do. There's a lot of pressure on environmental health officers. We've got the big burden they're carrying in some areas over the complete Brexit burach that has developed, particularly with exporting of foodstuffs and fish and shellfish. But there is a role for local authorities in this area, and we're encouraging them to fulfill it and supporting them to fulfill it. And the final point I'd make is this: people don't have to do this. And I know it is difficult to stay at home, and it is difficult to, not to leave except for exercise or other reasons. But they don't have to go to retail parks and shops, and they shouldn't go. And people should be saying, don't go to these, go for the essential purposes, which is why the shops are open.
It's what people are saying, though, Mike, is that some of the shops are exploiting this. They're selling essential items. And I was making an example there of cat food and stuff. But they're also selling the rest of the stuff that you don't really need. Right, and that can be restricted.
Well, I think you have to be very careful about that. If a shop is open, it is open. We saw the difficulty that happened in Wales when there was an attempt to define it in this way. But the range of shops being open is limited, and their purpose is to sell the items for which are essential, and we should encourage people so to do. So we are trying to encourage people to do the right thing, and we're restricting the opportunities to do the wrong thing. I think both of those are important.
Okay, thanks for that. I wonder if I could ask another question, possibly to Jason, if I may. It's to try and find out, Jason, if we know about test positivity amongst our supermarket and retail workers. Again, many of my constituents say to me that they're particularly worried because that's where the crowds are gathering. That's the only places left where there are large crowds gathering. But do we know whether the test positivity rate amongst supermarket and retail workers is higher than the general population?
The evidence I have, or that I've seen, is that it isn't. It's a bit like the teacher story. It follows the community prevalence, which is too high just now, let's be clear. So there are too many positives in all of these groups of individuals, but it doesn't appear to be a particular risk. And that is testament to the work of those individuals and the work of their employers to protect them as well as they can with protective screens, with PPE that they wear, and their own ability inside their break rooms and other places, which is where it's more likely to be transmitted, actually, when your guard just goes down in a teacher staff room or the back office in Asda where you have your lunch. But it would appear, although there have been a couple of outbreaks in supermarket employees, it's not big numbers, and it appears to follow the prevalence of society. But I do take your point that these people are taking a risk for us. They are at the front line, just like our teachers, our early years workers, and our health and social care workers are, and I'm hugely grateful for them to do that. And if this pandemic has taught us one thing, it's taught us the people who make the wheels turn of our society are really, really important to us. So we should continue to protect them, monitor those numbers, and put in anything in place that we need to.
Mm-hmm. Do you think that we're still doing enough, though, to manage the numbers of people going into supermarkets and retail centres? It appears to me, from what my constituents tell me, is that there's no limits on the numbers of people being allowed in, and there's no management of the people as they mix and mingle within the supermarket or the store. Can we think about doing some more to encourage the supermarkets to manage the numbers getting in? Because clearly it must be the last place that we've got left out there where we have large numbers of people mixing and mingling together, and so to try to reduce that would surely help us.
It is one of the last indoor places. Yeah, of course.
Could I just make a point? I don't think I can allow, sorry, Mr. Coffey, to get away with the fact that there is no work being done on this. I mean, there is. Supermarkets are making that clear. For example, a number of supermarket chains this week were announcing, quite rightly, that they were restricting people who were not wearing masks. They were reintroducing much wider spacing. I do accept that we need eternal and constant vigilance on this. but I don't accept that nothing is happening, and I wouldn't want that to be the outcome of people saying nothing was happening. Things are happening, and individuals going to stores should also be aware. A, they don't have to. If it is crowded, don't go. And if you are, there are other people there, queue in a socially distanced manner. I'm sorry, Jason, I just wanted to make that point quite firmly.
I was going to make the exact same point, maybe not quite as firmly, but I was going to do the supermarkets. I think have had quite a good week in terms of stepping up, following some meetings with Ms. Hislop and others around enforcing some of those things that perhaps have slipped since the first lockdown back in April, May time. I think there is a responsibility on the employer. There's also a responsibility on us as individuals to choose quieter times if we possibly can. Now, that's not always easy. Some people won't want to go in the dark. Some people won't be able to walk to where they... I understand it's not as simple as I perhaps suggest, but I agree with the fundamental principle that this is one of the last indoor places where people could potentially come together, and you should not go there for social reasons. You shouldn't, if you can, stop and talk to your pals, like supermarkets often are a way of people seeing their pals. Don't do that. Go, get your essentials when it's quiet, and leave. And employers, the supermarkets, have to play their part in helping that be true.
My point about nothing being done, Mike, is when people are in the store. If you've been in a supermarket recently, when you're in, there is really nothing that helps you to avoid bumping and passing by other customers. My point is that the stores don't seem to try to manage that when the people are in the store. It's a bit of a free-for-all. They might have arrows painted on the floor and so on and so forth, but really, come on, when people are in there, they're just mixing and mingling, and that, to me, brings additional risks that we could try to do something a little more about.
There are undoubtedly additional risks if that is the situation, but we are working, as Jason has indicated, hard with supermarkets to make sure they do that. We're reflecting, for example, in the regulations, these issues, and we'll continue to do so. And I know many supermarkets are very much aware of this and want to do so. And individuals have a responsibility too. Individuals, should endeavour to go as much as they possibly can when it is quieter. They should endeavour to keep their distance. Everybody's used to that now. And they should endeavour to say to others, "Please excuse me, I want to keep my distance." If they have to do so, and as Jason said, it should not be used by anybody as an excuse for socialisation. I mean, I don't regard shopping as a social activity, but I know lots of people do. It is not at these times a social activity.
Okay, right. Thanks very much for that. Thanks, Convener.
Thank you, Willie. Our final set of questions come from Annabel Ewing.
Thank you, Convener. Good morning to the Cabinet Secretary and to Professor Leach. I've got a number of technical questions which probably would be for the Cabinet Secretary on the regs before us today, and then a last question for Professor Leach if I have time. And at the outset, the regulations on the Social Care Staff Support Fund, I note that my question on uptake was asked by my colleague Stuart McMillan and answered, and I would just add that I'm very, very indeed to see that the eligibility is being widened by the regulation before us today. Next, the issue of the reasonable excuse to be out with the home in terms particularly of travel. I don't know if the Cabinet Secretary noted today a report in the papers about a family in Wales that were caught short in terms of a visit over the 5 miles or whatever the equivalent is in Wales to see a relative in a care home. And my understanding is that the position in Scotland is different, that actually to travel beyond 5 miles to visit a relative in a care home is okay, and it would just be helpful if the Cabinet Secretary could clarify that for maybe folk who have read that newspaper report today, because I don't think the newspaper contained any mention of the fact that the position in Scotland was different.
The regulations specifically make it clear that a visit to a care home in the circumstances you mention is exempt from the issue of having to stay at home quite clearly, and travelling therefore is permitted for that purpose. There are other regulations for a care home, for example, a single individual on an outdoor visit, and restrictions in Tier 4 areas, but that one is clear.
Thank you for that clarification. Thank you, Cabinet Secretary. On the issue of the Regulation 2020-471, I think Regulation number 9, prohibiting travel between Scotland and the Republic of Ireland, I understand that the motivation for this inter alia was the fact that Ireland went into a level 5 lockdown in December, and that these regulations in Scotland took effect from the 26th of December. Could I just seek clarification where you may have a non-cohabiting couple, one part of which resides in Ireland and one member resides in Scotland? Is therefore the ban such that they would not be able to one to the other visit? And of course, one would also have to look at the regulations pertaining in Ireland. But as far as Scotland is concerned, would the fact that they are a non-cohabiting couple not be sufficient to fall within any exemption to this travel ban?
I don't think there is such an exemption, but I don't want to say definitely at this stage, so I'd rather answer that question in writing to you. I will, asking it at this particular moment is apposite, because within an hour and a half or so I shall be talking to Simon Coveney, the Irish Foreign Minister, so we will be discussing, amongst other things, the Brexit regulations and the bans on travel. But I believe that the exemption you've given is not sufficient, but I don't want to confirm it until I've checked and confirmed it with you in writing, which we will do quickly.
I'm very grateful to the Cabinet Secretary for that. That's a particular constituent interest there. With regard to the First Minister's statement yesterday, it's made to statutory guidance for employers that will be forthcoming, which will in effect reiterate that if somebody was allowed to work from home in the first lockdown, they should be allowed to work from home now. Can I ask when this statutory guidance will be published? Because again, I have a very pressing constituent issue on this matter. Thank you.
Well, it will be published very shortly, but you should take it as being effective. Now, the regulation on working from home is quite clear. That is a default position, and it would be very difficult for an employer to justify, without justifying a very substantial change in the role of the individual, that any individual in the circumstance in the first lockdown should be in a different situation now. And I would advise employers not to attempt to make that justification, so you should take it that that is the position now, and is a position that can be quoted now.
Again, I thank the Cabinet Secretary for that answer. Turning to a different issue, just because, again, I had noted reports over the last few days, and because we have, in particular, Professor Leach here, it's always good to take this opportunity, short of phoning into Off the Ball on Saturday, which I will recommend people listen to. It's very informative on a host of issues. But Professor Leach, I have read very alarming reports that in some hospitals in England there's a shortage of oxygen, and the advice is to dial it down, which, if you're the patient, would be particularly concerning. I think this shortage has been acknowledged by the UK Prime Minister as well. Could Professor Leach just clarify and provide assurance that this is not a position that pertains in Scotland? Thank you.
Yeah, and thank you for your kind words about Off the Ball. I'm not sure it's a universally held view that they want me on the football programme, but for now, getting the messaging across to an audience that is not listening to GMS and the Today programme, then it's hugely helpful and quite good fun, if I'm honest, but don't tell them that. The oxygen challenge is related to intensive care and high dependency. It's not so much that England doesn't have enough oxygen. It's to do with just the scale of intensive care required, and the piping and the resourcing and everything else that has to go into getting quite high flow oxygen to people who are very sick. And one of the key ways of treating this disease when you're struggling to breathe is to give you high flow oxygen while your body takes time to recover. So it's very oxygen heavy, the treatment of this particular disease when people are very sick. So it's not that the tanks don't have enough oxygen in them. It's the logistics, of course, of doubling, trebling, quadrupling your intensive care units. And you don't build brand new shiny intensive care units. You put people in theatres, or you put people in wards that don't have the same infrastructure. So that's why you've seen in some English trusts them struggling to get enough oxygen to enough people. Now, my colleagues in England have moved people around, they've airlifted people, they've put mutual aid in place. We've even done some of that for Carlisle into Dumfries, exactly as we should, and they would do the same for us, vice versa. There is no present oxygen challenge in Scotland. We have enough both of the oxygen and of the kit to get it to the patients, but we shouldn't be complacent. As we said at the beginning, there were 107 intensive care admissions in the last 7 days. 107. In peacetime, we have a capacity in intensive care of around 120. So we are already, just with COVID, reaching what was a peacetime capacity. Now we're well beyond that capacity now. We've got available space. People shouldn't be worried, but it's just to put in perspective what COVID has done to the National Health Services of the UK. And we look on with horror and fear about what's happened in the southeast and in England, but this is not a competition. I'm in touch with my colleagues there, and I feel for them. We want to help them as much as we can, but equally, if there are bits of England that don't have that challenge, and Scotland not having that challenge, we want to keep that prevalence down in order for us not to have to face those same challenges.
I thank Professor Leach for that answer, and I mean, I absolutely take mutual assistance as a given. We're human beings, but equally, it's comforting to know that we're not at that. We don't have that problem at this point in Scotland, and presumably, contingency planning is always reflected upon to ensure that, as far as possible, that we don't reach that point in Scotland. That's my questioning for today. Thank you to both gentlemen, and thank you, convener.
Thank you for that. I just would like to correct one issue that's arisen in respect of an answer given by the Cabinet Secretary in terms of the eviction legislation. Just for the record, we are aware that the measures in the Coronavirus Scotland Act 2020 already amend eviction law to provide for longer notice periods, and these have already been extended to the end of March 2021. But the regulations we're scrutinising today refer to the specific time-limited ban on the enforcement of evictions action, which have been in place since the 11th of December 2020 and are due to expire on the 22nd of January. And I just wonder, Mr. Russell, if when the Housing Minister responds to the committee, we would be grateful to understand the monitoring of these specific regulations and any potential plans to extend these specific regulations rather than the Coronavirus Scotland Act 2020.
Thank you for drawing attention to that. Yes, it is the regulations you are specifically addressing today, which you're referring to. Quite clearly, there is a requirement, and we believe a requirement, to continue with the actions. And I'll ask the Housing Minister to respond to you on that.
That concludes our consideration of this agenda item, and I would like to thank the Cabinet Secretary and the National Clinical Director for their evidence this morning. I now move to agenda item 2, which is consideration of the motions on the subordinate legislation that we have taken evidence on in the previous agenda item. Cabinet Secretary, would you like to make any further remarks on any of the SSIs before we take the motions?
No, thank you.
Thank you, Cabinet Secretary. Are members content for motions S5M 23684, S5M 23749, S5M 23807, S5M 23809, S5M 23826, and S5M 23828 to be moved en bloc? And if any member is not content with this approach, please can you type N in the chat bar now, please? Okay, it appears that members are agreed to move the motions en bloc. So can I now invite the Cabinet Secretary to move en bloc the following. Motion S5M 23684, that the COVID-19 Committee recommends that the Health Protection Coronavirus Protection from Eviction Scotland Regulations 2020 SSI 2020/425 be approved. Motion S5M 23749, that the COVID-19 Committee recommends that the Health Protection Coronavirus Restrictions and Requirements Miscellaneous Amendments Scotland Regulations 2020 SSI 2020/439 be approved. Motion S5M 23807 that the COVID-19 Committee recommends that the Social Care Staff Support Fund Coronavirus Scotland Amendment Regulations 2020 SSI 2020/469 be approved. Motion S5M 23809 that the COVID-19 Committee recommends that the Health Protection Coronavirus Restrictions and Requirements Local Level Scotland Amendment Number 9 Regulations 2020 SSI 2020/471 be approved. Motion S5M 23826 that the COVID-19 Committee recommends that the Health Protection Coronavirus Restrictions and Requirements Local Level Scotland Amendment Number 10 Regulations 2021 SSI 2021/1 be approved. Motion S5M 23828 that the COVID-19 Committee recommends that the Health Protection Coronavirus Restrictions and Requirements Local Level Scotland Amendment Number 11 Regulations 2021 SSI 2021/3 be approved.
Moved en bloc.
Does any member wish to speak on any of the motions? If so, could you please indicate this by typing R in the chat bar now? I note that no member has indicated that they wish to speak, so I will now put the question on the motion. Question is that motions S5M 23684, S5M 23749, S5M 23807, S5M 23809, S5M 23826, and S5M 23828 be agreed to. Does any member disagree? And if so, please type N in the chat bar now. Can I confirm that the motions are agreed to? The committee will publish a report to the Parliament setting out our decision on the statutory instruments considered at this meeting in due course. That concludes our consideration of this agenda item and our time with the Cabinet Secretary. Can I reiterate our thanks to the Cabinet Secretary and the National Clinical Director for their attendance this morning, and that concludes our business for this meeting. The clerks will update members on the arrangements for future meetings in due course, and I now close the meeting. Thank you.